Thank you all for your patience. I walked in the lobby and I just flew in from Evansville, where I had the privilege of greeting the President of the United States when he arrived in Indiana for the second time this week. We had an opportunity to talk about exactly the issue that Joanne just mentioned, and he was talkative. So it's not entirely why I'm late. There's some of that you know about with regard to air traffic control in this part of the world. But it is a joy to be with all of you for a number of reasons that I'll share in just a few minutes. And then I really look forward, as your rounds permit, to have a chance to meet as many of you personally before you have to take off. I do want to thank Representative Charlie Brown. He is a tall tower in the Indiana General Assembly, highly respected. While we come from different political parties and perspectives, he's been someone who has always been willing to sit down and find ways for us to work together for the health and well-being of the people of Indiana. Charlie, I thank you very much. First and foremost, let me thank all of you. It's wonderful to be in East Chicago and to come here to St. Catherine, which is a hospital that enjoys such an extraordinary reputation for quality and compassion in this community. I truly believe this institution is a blessing to the state of Indiana and to each of you that come here every day and come alongside some of our most vulnerable citizens, some of whom are facing some of the greatest challenges of the people of our state. Is a tribute to you. It's a tribute to your professionalism. It's a tribute to your hearts. And so let me just, on behalf of the people of Indiana, let me thank the St. Catherine team for a job well done. You are admired across the state. And I'm so pleased, Joanne mentioned our efforts in Indiana. We have, over the last 6 years, and I did talk to the President about this today. Over the last 6 years, the state of Indiana has, I think, had one of the most innovative healthcare programs in the country, serving Medicaid eligible Hoosiers, people, I don't like to say low income, I like to say people that are starting out in life, on the first rung of the American dream. The Healthy Indiana Plan was crafted on a bipartisan basis at the Indiana General Assembly by my predecessor. A waiver was secured from the Health and Human Services Agency of the Bush administration to allow Indiana to use cigarette tax revenues to fund a program that over the last 6 years has provided, I think, exceptional coverage for some 40 to 50,000 Hoosiers per year. The program itself has been renewed and approved on 2 separate occasions by the current administration, and which is a point that I made to the President today, that we're grateful for the fact that this administration has approved, once under my tenure as governor, a renewal of this plan. And it was right to be renewed because it's a plan that works. I know that I have in the room, I haven't met her yet, Yolanda Kamatz, I was told is somewhere here. Yolanda is someone who is, there you are. I said hello, didn't know it was you. Yolanda, I believe, is currently in the Healthy Indiana Plan and has greatly benefited by it. In fact, had some diagnostic work done here at St. Catherine today. And is just one of the people of some 50,000 Hoosiers who have had access to affordable health insurance coverage through the Healthy Indiana Plan. But it's not just that it's affordable that makes me proud of what Indiana has done in a bipartisan way with what people call HIP. And I struggle with that as well. My kids say, Dad, you're a lot of things, but you're... Yeah, you're there, thanks. But what I like about it the most is what the Healthy Indiana Plan does is it builds on the principles of personal responsibility and human aspiration. I mean, what the program that Yolanda is a part of is a program that requires people to make monthly contributions to their own health savings account. it is in a very real sense not so much a handout as it's a hand up. I mean, we've created a framework in Indiana that allows people to have affordable health insurance that covers them, but it also encourages them to move from emergency room care to primary care. Okay? I mean, there are incentives and disincentives built into this program that encourage people to engage in preventative medicine. I mean, one of the things that endorses what you experts understand is of the consumer-driven healthcare, and is that when you have people that have skin in the game, the argument goes, when people are making that contribution, they take greater ownership of their own healthcare, and two great things happen. Number one is, by taking greater ownership of my own healthcare, I have an incentive to make better choices. I mean, each of us are our own worst enemy when it comes to our own health, right? I get that. But by creating a system in healthcare, it gives people an incentive by allowing people to roll over what's in their health savings account at the end of the year, and rewards the use of preventative medicine. We see through this program that people's health has been improving in Indiana. And frankly, in consumer-driven healthcare around the country, that's been a pattern. The other thing we see from a public policy standpoint is by encouraging Hoosiers to take greater ownership of their own health care, as their health improves, the costs go down for us overall as a state and as a people. And so it is in every real sense a win-win. And that's why I've said the reason I'm so passionate about renewing the Healthy Indiana Plan and using it as a framework for any expansion of coverage is because I think it's right for Hoosiers' health, and I think it's right for the fiscal health of our state and of our nation. And that being said, we submitted a waiver in May, and came up this way, not at St. Catherine, but another fine hospital in the area. I talked to the president today. One of the last two things I said to the president today was, I want you to know that we're very sincere about wanting to expand coverage in our state using the Healthy Indiana Plan. I mean, sometimes we all see it in the papers and on cable TV. Sometimes people in politics say they want to do certain things, and you can weigh the sincerity for you. To the president, with whom I have a good personal relationship, and I said, I want you to hear from me that we're really committed to doing this. And he responded very respectfully and very thoughtfully to me about that. But then I also told him that time was really of the essence. Our current waiver for the Healthy Indiana Plan runs out at the end of this year, and I'm going to be traveling to Washington on Monday to meet with the Secretary of Health and Human Services to continue this discussion, and the President acknowledged he was aware of the time-sensitive nature of this. But the proposal that we sent in to the federal government would allow us to take this proven program, this proven bipartisan program of the Healthy Indiana Plan, and use it to expand coverage using Medicaid resources to some 350,000 Hoosiers who today can't afford health insurance. And there are benefits to that for them by allowing more Hoosiers to participate in this program. And secondly, by one of the ways that we have structured the program is by reimbursing healthcare providers at the Medicare rate. And now I'm getting a little bit technical here, but Joanne and the team here and your CEOs in the room, we think it's going to increase access for people that are enrolled in this program. Because I'll be candid with you, I'm not a fan of traditional Medicaid. And I did say to the president again today that we were not interested in expanding traditional Medicaid in Indiana because, frankly, I think there are many flaws in the system today. We have many Hoosiers that rely on traditional Medicaid, and we make it work to the best of our ability. But the docs and the physicians and the healthcare providers in the room know that fewer and fewer physicians and healthcare providers are taking Medicaid patients, and it's affecting the ability of access. In fact, there was a recent study that showed out west that in one state that people that had Medicaid coverage didn't have any better health outcomes than people that went into emergency rooms with no coverage at all. And so in Indiana, my view has been that Medicaid's not a system we need to expand. It's a system that I believe we need to reform. And what's exciting about being a Hoosier today is I think 6 years ago, we really crafted a framework for the kind of Medicaid reform that empowers the individual, respects the dignity of the individual, will drive us toward better healthcare outcomes and will achieve long-term objectives in our healthcare economy. I will tell you, standing on the tarmac beside Air Force One with the President today, we talked about issues that have arisen in the course of our discussions with his administration, and he was aware of those and informed me that he had spoken to the Secretary of Health and Human Services himself this morning on this topic. But he reiterated to me their desire to continue to discuss and continue to explore, and I take him at his word for that. But my pledge to each one of you is that we're going to roll our sleeves up and work hard to make this happen the Indiana way. I really do believe Indiana in so many ways, and I'll close with this thought. I think Indiana in so many ways has been a leader. I mean, we're leading in job creation and particularly in areas of manufacturing. We're leading in labor force growth. We're leading in a broad range of areas. Second best improvement in our 4th and 8th grades, according to the nation's report card. Last fall, our kids are doing better every day. Graduation rates are up, test scores are up. But among all those areas of leadership, we've been leading in healthcare and healthcare reform. And I'm absolutely determined as your governor to continue to lead and to continue to provide on an increasing basis, if we're permitted, the kind of coverage for Hoosiers that is affordable and that also puts them more in the driver's seat for their own health care. I mean, I think one of the beautiful things about the Healthy Indiana Plan is it recognizes the desire and the capacity of every individual to make their own way and make better choices in their life for themselves and for their family and their health. And that's just common sense. And that's, I like to say common sense is a lot like basketball. They say we didn't invent it in Indiana, okay, but we perfected it here. And I think that empowering individuals, having people take ownership of their health care, creating incentives and disincentives the way the Healthy Indiana Plan does that is a framework for good health for Hoosiers. And I think it's a framework for expanding coverage in a way that will be in the long-term interest of the healthcare provider community and our state as a whole. So that's a bit of the update on today. I really am looking forward to mixing and mingling and working my way back to the buffet. But let me say in closing 2 things, and I really mean these from the heart, is number one, all the work that I have an opportunity to do, and I've been in public service for 14 years and in and around public life. I was a Democrat when I started out. I'm a Republican now. All that we do in public life, I believe, pales in comparison to what each one of you do in these hallways every day. And I want you to know that this community and this state are truly grateful for the compassion and the professionalism and the sacrifices you and your families made to provide the level of care that is synonymous with St. Catherine. And so I thank you for that. And I also want to say, number 2, is just thank you for the privilege of being your governor. I promise you, I will never have any higher honor in my life than serving this great state and this great people as your governor. So thank you very much, and God bless you.
Extraordinary people, extraordinary care.